Welcome to Module 8, Translating Social Determinants of Health Research to Policy. In this session, the researcher will learn how to deliver the key messages derived from their work, and also develop techniques to communicate those messages to a varied audience such as policymakers and stakeholders. This class will focus on the Indonesians and Vietnam case studies for influencing tobacco control policy. Why tobacco control? If you look at Indonesia's tobacco prevalence, in 1995, there were 54% around that Indonesian smokers, and it increased into 67.4% in 2011. The youth is more alarming. The tobacco prevalence in youths start from 13.7% in 1995, became 38.4% in 2010. So that's why tobacco control policy should be in place, but it is not an easy way. So there are 4 objectives of this class. 1, to discuss challenges of transferring research findings into action using various types of communications mechanisms. 2, to discuss the risk of presenting research findings to various stakeholders. 3, to discuss research policy link in tobacco-related program. And 4, examining the difference between Vietnam and Indonesia in making social determinants of health-related health policy. Some points of this effort. The social determinants of health must be addressed through effective policies based on sound global and local evidence. Translating the evidence from health research evidence needs operational research that bridges the gap between the discovery and the delivery. Delivery effectiveness comes through brief, carefully constructed, and feasible interventions that public health workers can implement in multiple real-world settings. There are 2 challenges of social determinants of health research to policy making. Challenge number 1, these efforts refocus on research that is contextual, practical, and robust, and move public health towards sustained intervention effects at both the individual and community levels with ensured equity. Challenge number 2, translating research to influence public health practice and policy requires explicit attention to the real-world challenges and implementation and scaling up. In this sense, Marmot and Bell emphasize that translating the social determinant of health recommendations effectively into national policies and practice arenas will require top government leaderships, that's very, very important, and then action across diverse policy areas, community participations, and integrations of local, national, and global efforts. So there are some strategies for implementing social determinants of health research. Strategy number 1 is to undertake intersectoral and social determinants approaches. Number 2 is sharing lessons from interventions that have made a difference. Number 3, bridging the gap between research evidence and practice. Number 4 is a stronger public policy agenda. And number 5 is the public support for eliminating health inequities through good health policies. These strategies will be learned through 3 sub-modules in this session. 1 is the Indonesian policymaking in tobacco control. The second sub-module is the Vietnam policymaking in tobacco control, and to compare Indonesia and Vietnam policymaking. This is the part 1 of the modules about Indonesia's policymaking on tobacco control. There are 3 objectives of this part. After this part, the participant is expected to 1, understand the challenge of researchers in presenting the evidence of social determinant of health research to gain concerns on necessary policy, be able to conduct sector analysis, and lastly, be able to communicate research findings for changing policy to various types of stakeholders. There will be three topics in this part. One, on health policy and social determinant of health researchers. It will be presented by me, Laksono Trisnantoro. The second issue is on stakeholders analysis, and it will be presented by Ratna Siwi Fatmawati. And lastly, the issue on how to communicate the policy to various stakeholders, and it will be presented by Abdillah Ahsan and myself. So I will speak about what is policy making, how tobacco control policy is shaped in Indonesia, and how to communicate about SDH policy to various stakeholders. And these are the experiences of SDH researcher in Universitas Gadjah Mada, Indonesia. So let's discuss about the public policy. Policy is decision taken by those with responsibility for a particular policy area, including in tobacco control. Public policy refers to policy made by the state or government by those in public sector. And if we look at in the public policy in tobacco control in Indonesia, we have the decentralized system. That means the policy of tobacco control consists of policy at national level, policy at provincial government, and also the policy at the district level. So there are three layers of policy in decentralized Indonesia. I will speak about the key stages in policy making in Indonesia. So we have at least 5 stages of policy making: the agenda setting, policy formations, policy adoption, policy implementations, and policy evaluations. And now we can see how the tobacco control policy situations in every stage of policy making. In agenda setting, raise the issue at national and local level. And this is not easy. Some of the local government rejected the idea of tobacco control. At the national level, still very, very difficult to raise the agenda of tobacco control. In the policy formation, although we have some government regulations for tobacco control, but still very difficult to address in many districts or provincial government. And when we go to the adoption, we have some examples of the provincial government and also some district government that already have some tobacco control regulations. But the implementations not as strong as on paper. So there is some failures in terms of tobacco control regulations implementations. And we haven't yet had any firm evaluations of policy in tobacco control. So this is the rough conditions of Indonesians policy making in tobacco control. So we have some challenges of our researchers in tobacco control. We have to think that we have to use what we call the global evidence for Indonesians implementations, or maybe the use of the global trend for Indonesians purposes. It is very clear that the global evidence is used for policy making across countries. But again, this is not the fact in Indonesia. Why? Yes, we have to look at the stakeholders. The pros and the cons of tobacco control policy is so strong in terms of the different ideas. So that's why research in this high controversy has the risk of being rejected by policymakers. From the beginning, from the agenda setting, already many rejection from the policy formations, and there's no adoption. And this is the challenges of our researchers in terms of presenting the result of the research to the policy makers. So that's why from this point, we need a detailed stakeholders analysis.